our next speaker, Dr. Krishna Gudi. He is the junior epidemiologist and is also an integral part of the Epidemiology and Surveillance Unit, Health Seniors and Active Living at Manitoba, Canada. He is also simultaneously pursuing his PhD from the Rady Faculty of Health Sciences, College of Pharmacy, University of Manitoba, in the domain of epidemiology and outcomes research. So I don't think we could have had a better faculty to speak to us. He is also the proud recipient of prestigious awards and scholarships. So, sir, we are really privileged to have you, and you could take the next 45 minutes, sir.
Thank you so much, Sophia. Hello everyone. Firstly, I hope you all are doing well and staying safe, especially during these unprecedented times. And let me share my screen. So, are my slides visible?
Yes, sir, we can see that.
Sure, perfect. Firstly, to begin with, it's always such a pleasure to talk to the NITE University and the NITE people. And it's my honor to share my thoughts on this topic, that is case reports and drug safety research. So first, let me tell you what's the rationale behind choosing this research topic for today's presentation is I have been seeing a lot of people, I mean researchers, talking a lot about real world evidence, real world data, and how our cities could actually inform the decision making. Also, a lot of things about systematic reviews, meta-analysis, and of course, they are also considered as gold standards while making any decisions, especially in the healthcare sector. But somewhere I felt that the case reports, which are also one of the essential study designs in the field of epidemiology, in specific pharmacoepidemiology, have oftentimes been overlooked by the researchers and the scientists all around the world. So that's the reason I just wanted to advocate these case reports, by taking this platform as a chance. And even myself, quite a time ago, even I have been advocating systematic reviews, meta-analysis, and real-world evidence like randomized controlled trials and high quality observational studies. But I just thought of taking a step ahead and just share my thoughts regarding case reports and how actually they could change the landscape of the pharmaceutical market around the world. So since I was just given 30 minutes of today's schedule, so I'll just jump into today's topic, that is the importance and the role of case reports, especially in drug safety research. As Sophia had mentioned, myself, Sai Krishna Gudi, a PhD research scholar here at College of Pharmacy, University of Manitoba, Canada. So I don't have any potential conflict of interest to disclose with regards to this presentation and whatever I'm going to deliver today. However, I just wanted to start my talk by putting this statement in front of you, that is, whatever views or the opinions that I'm going to express in this presentation are completely out of my own, and they do not reflect any official position or policy. Starting off with today's objectives, I'll make sure that at the end of this presentation, each one of you will be able to understand the basic terminology that's being used around the drug safety research domain, especially pharmacovigilance. Also, you'll be able to know what exactly is a case report, why is it so essential, and what role it plays in making the informed decisions. Also, how these case reports could impact the pharmaceutical market around the globe. Also, I'll briefly touch the importance of case reports in this medical research. Also, identify the roles of, the important role that these case reports have during outbreaks, like, outbreaks and pandemic situations, like currently we are in like COVID-19 situations, like what can they infer and what role they play. Also, I'll also briefly touch on the impact of these case reports on pharmaceutical market, like what credibility and potentiality that these case reports hold in just withdrawing a drug from the market. At the end, I'll just list out some of the strengths and limitations that I wanted to share with you with regard to the case reports itself. So this is the brief outline of my today's presentation. I'll not take much time of yours, and I'll try to finish it off as soon as possible. So just pay a little bit concentration. So starting off with some basic terminology that is widely being used in the area of drug safety research. I oftentimes listen people using adverse drug events and adverse drug reactions interchangeably and synonymously, which isn't actually, they both are two different entities and they infer two different things. Looking specifically at adverse drug event, regardless of whether it's an event or a reaction, they both are harmful and unintended effects. But if that unintended or harmful event occurred during the drug therapy or when the patient was on the current medication or on any regimen, then it is known as an event. But if the same harmful and unintended reaction, if it happens later on or following the drug therapy, then it is known as adverse drug reaction. So quickly moving on to side effects. So I also hear a lot of people, even from academia and from the university, they use side effects interchangeably for stating adverse drug events, which is not correct. Coming to side effects, these are not harmful, or this could be an unintended effect for sure, of course, but these might not be always harmful. In most of the cases, if any reaction or any event that occurred due to the specific drug regimen or any drug treatment which is not harmful, it is called a side effect. So that's what I state here. It's an effect other than the intended one. So let's very quickly look at an example that clearly demonstrates what exactly a side effect is. So here is a case report where they have assessed the association between the reduction of migrainous headaches with the use of esinocomerol. We all know esinocomerol is an anticoagulant medication. It's a vitamin K antagonist. And we also know migrainous headaches. It's one of the types of the headache. And when patients were given this esinocomerol as an anticoagulant therapy for those with such conditions, they have found or noticed reduction in migrainous headaches, which is actually a good thing. So in this case, this is called as a side effect but not adverse drug event or adverse drug reaction. So I hope the terminology and the concept, whatever I have been talking, is clear. And that's what it says. Side effect is not necessarily a bad news always. It could also be a good news. Most of the times it's a good news. And it could also act as an innovation trigger, meaning it could lead to come up with a different research questions or to investigate the association of the drugs or off-label indication of the drugs, also known as repurposing of the drugs. So that's about HEOR and side effects. I don't want to spend a lot of time with this terminology. So this is a classic example, which actually walk you through what exactly a side effect is, although I have mentioned one in my previous slide. That is perming effect associated with valproic acid. So as you already know, valproic acid is one of the potential treatment options for epilepsy. And when a patient was put on this valproic acid back in 1980s, this is almost 2 decades ago, a patient was reported that actually a perming effect of her head, meaning it's a curling effect. If you look at the first picture on my left, that was a picture of a lady before starting the valproate therapy. If you observe her hair, it's like pretty much straight, but when she was put on this valproic acid, her hair started become curling, and the perming effect is like very significant and predominantly seen. Then when the de-challenge has been happened, and when she was put off the drug, then again her hair texture seems to getting normal or going back to the straight structure. So that's what if actually this patient likes or wants to have her hair curling, it's actually a good news for her. But still, in this case here, we cannot call this a reaction or event as a harmful event or adverse drug event. So it could be a classic example of side effect. The similar case report was reported after almost 20 years after in 2007. So the similar effect was seen in again a female patient who was put on the valproic acid. And that's actually the importance of case reports. For the first time when a patient reported that perming effect, nobody actually could able to explain the association between the valporate use and the perming effect, and they just ignored, and the things have been overseen. But after 20 years, it was again noticed in one more individual. So some more terminology, that is causal or casual. You might be, frequently hearing these terminologies if you are working as an intern or doing any clerkship in any hospital, mostly family students. Like whenever we come across any adverse drug event or adverse drug reaction, we just wanted to assess the causality or cause and effect of that particular reaction. So these are the three important terms that we need to keep in mind. The first one is challenge. That is whenever the first time we come across any new reaction or the onset of new reaction because of that is associated with any drug or drug regimen, that is known as a challenge. And then if because of the challenge, if we ask or if we request the patients or if you put the patients off on such medications, then it is known as a de-challenge. That is the course actually after stopping that actual medication, meaning we are asking patients not to take the suspected medication. And then due to risk benefit ratio, and if patient if our patient or an individual wants to take the medication for various reasons, like if suppose if it is any diabetic medication, there are obviously there are quite various options to just stop that particular suspected drug and to shift to other drug. But still, if that is the only drug that is being available for that particular patient, then we need to again reinitiate or put that patient again once again on that same medication after some time after doing a de-challenge, that is known as a re-challenge. So I hope I'm clear with the concept of challenge, de-challenge, and re-challenge. And if any questions, I'm happy to take and address them end of the session in question and answer part. So it all depends upon the exposure to event time. Based upon exposure to event time, all these criteria or these factors have been defined. So causality, as I mentioned, the causal association, whether we should make sure that whether it is a causal association or a causal association. So causality is defined as any influence or relationship by which an event contributes to the production of any other event. If one event, or suppose pertaining to our topic, if any drug is associated or play a role in causing any other event or the production of any other event, where the cause of the reaction is partly responsible for the effect, whereas the effect is partly dependent on the cause. So to put it in a simpler words, if a drug causes any reaction, the both will have contributed to that reaction. The reaction is partly dependent on the exposure that is a drug, and the drug is partly responsible to cause that reaction. So that's what the causality is defined as. And here are four categories. We have various scales and checklists to assess the causality, like Norenzo scale and WHO scale. And most probably these are the four categories that have been that we have been putting these associations into, regardless of any scale it might be. Those are unlikely, possible, probable, and certain. So starting with unlikely, if the association between the exposure and an outcome, that is your usage of drug and causing that particular reaction, is like couldn't be explained by any existing literature, or if there is any information that we cannot assure that actually that reaction is caused by that particular drug. In such cases, we assign the category by name unlikely. Moving on to possible, there might be some possible association we can guess in between the drug and that particular reaction that has happened. In such cases, we use the term possible. Probably would be the probability would be more. I mean, there might be some literature or some pathophysiology behind the reaction which could actually support the reaction or the event to happen. Then in such cases, we are like, we are sure that there might be a huge probability that this drug could actually lead to this reaction. Then we will assign a tag of probable. And lastly, certain, and we are damn sure, and we can say that this drug can potentially lead to this reaction. Then we give a tag on a certain. So don't just mind. I'm rushing to the slides because This is just a basic terminology which most of you are already aware, and I just wanted to touch base on this, not to spend a lot of time, but I'll keep my pace very slow coming on with the coming slides. So it all depends upon the probability. Based upon the probability, they classify the associations into these four categories. So starting with our today's talk, that is case report. So what exactly a case report? So looking at its definition, case report is a specific type of study design. Most often we'll be hearing a lot about randomized controlled trials and high quality observational studies like cohort studies, retrospective studies, case control studies, systematic reviews and meta-analysis. But even case reports are a specific type of research design that actually have its own importance. And it's actually a scientific document which has a clear detailed story, some interesting story of a single patient which was observed for the first time. So I just wanted to specifically mention or stress on this word, that is single individual patient. So it's just a report of a single individual patient, that too which was observed for the first time. And in that case, it is known as a case report. That the reaction should be unusual or unexpected. Oftentimes, it could be harmful or unintended reaction, most of the times, which could be attributed to any drug. So those are case reports in short. And what exactly they infer? I mean, what they actually inform us. So as I mentioned, it's a scientific document that describes and interpret an individual case in a very well written manner. It's like a detailed story where if you get any chance of, I don't know whether you got any chance of looking at a case report. I hope most of you are aware of how the case reports are being authored and written, the style of narrating when we publish or communicate to a journal. So it's an individual case where a physician or a person or a healthcare professional, maybe a clinical pharmacist, whoever reports this case, they start with the demographical details of that particular patient or an individual, stating his or her age and what medications that patient was on and what exact medication is being suspected in this case, whether a de-challenge is done, and again whether a re-challenge was done, and all other necessary information which usually we lack in a very clear way in other type of study designs. And they infer it's a unique case, as I told, that cannot be explained by known disease or a syndrome, because this is a reaction or a disease perhaps which we are identifying for the first time, meaning we have never witnessed such disease or such a condition or such a event or a reaction in the past, and we have observed this for the first time in a single patient. Thus they are unique cases. And these are the cases that show an important variation of the disease or a condition. So at times, case reports need not to be they need not give rise to an entire new disease, such as like, for example, like COVID-19 or any such pandemics or outbreaks. Even case reports could be, they could be of a slight variation of an existing disease, a slight variation of a diabetes or hypertension. It could be a slight variation from the existing disease as well. Also, these are the cases that show unexpected events. As I told, even these are unintended harmful events that might yield new or useful information. With that being said, as I told, these are unique cases we have never heard about. For the first time, we have come across and we have identified them in a single patient. So there might not be a lot of information that is already existing. So in most of the cases, these case reports are very useful and they give a lot of information to come up with therapeutic strategies, or to prepare a vaccine, or to prepare any to design any dosage regimens for such reactions or for such disease conditions. So the bottom line would be, what I want to say is they actually hold their own importance and they are very essential as well. So let's very quickly look at the actual difference between case reports and spontaneous reports. I'm sure at least some of you might have heard the term spontaneous reports. So from my experience, I have seen people using these both terms interchangeably or synonymously, which actually are different to some extent. So the case reports, as I told, these are the unique cases which was identified in a single case for the first time. At the same time, even spontaneous reports are such ones. But where exactly they differ is in a way these reports are being reported, to whom these reports are being reported, and in what way these reports are being reported, and to what extent the details are being reported to particular organizations or the agencies. So let's first look at the spontaneous reports. So let me give an example. Suppose there is a physician or a GP, general practitioner, who came across a case report in his or her daily practice or daily settings with his patient. And then if the doctor or physician decides to report this reaction to any local or national pharmacovigilance centers, or a global pharmacovigilance center, that is Uppsala Monitoring Center, then that is known as spontaneous report. So it's kind of moreover reporting any adverse drug reaction to the local or national organizations. Whereas the same doctor, if he or she decides to go ahead and publish this reaction as a case report in a peer reviewed journal, then it is known as a case report. So they are reporting the same reaction, but if the reaction is being reported to the regulatory agencies or national pharmacovigilance centers or regional pharmacovigilance centers, then that is known as spontaneous reporting. If that is being published in any peer reviewed journals, then it is known as a case report. So I hope the concept is very clear. And also, however, these case reports differ significantly from spontaneous reports in two different ways. The first one could be they actually enjoy the peer review quality, the complement of peer review. Since as a fact that these case reports will be published, they will be undergoing a peer review process by the editor themselves or by any peer reviewers, which whereas the spontaneous reports are being just reported to the agent, to the local agencies by the any healthcare practitioner or the patients by themselves. The second one would be these case reports actually may have the immediate wider visibility, and they can gain a lot of visibility because they're being published, and a lot of people, or each journal will have their own readership, where once a case report has been published in any journal, it can actually gain a lot of readership, and in that way the message is widely disseminated among the general public as well. Whereas in spontaneous reports, it's not usually the case, because it mostly the information would be in between the doctor or any healthcare professional who is reporting, and in between the agency or any national organization which is receiving the report. But the normal general public or a layman might not actually understand or will come to know about these signals, possibly what's exactly happening. So that's the basic difference between case reports and spontaneous reports. So yeah, that's what I have been talking about. Although these spontaneous reports are backbone of national pharmacovigilance centers, published case reports can gain immediate access and have better understanding of real life situations, because as I told, these case reports will have clear, detailed, interesting story of that particular patient, where the reaction has been identified, and we all can go through this story, like or what exactly the patient demographics look like, and when the drug has been started, when the reaction has been identified, when the drug has been de-challenged and re-challenged, everything clearly, which might not be possible to gain all this information from spontaneous reports. So I'm sure that most of you might aware of this diagram. It is known as evidence-based pyramid, which actually classifies the various types of study designs based upon the level of evidence and quality of evidence that has been generated from the study designs itself. But it's very unfortunate to have these case series and case reports to be at the bottom of the pyramid. And this pyramid, as I told, as the type of study design moves up, it means the quality of evidence is getting more and more, meaning whatever designs are at the bottom, they might hold a less quality of evidence in terms of making any informed decisions when compared to systematic reviews or our randomized controlled trials. But what I wanted to sorry, what I wanted to stress a little bit here is, despite this randomized control trials, systematic reviews, and meta-analysis, case reports continue to give a novel information and to provide the exceptional knowledge to the medical field or medical research itself. Because you know whatever understanding that we have today about many diseases are actually, they actually begin with one such case report. That could be HIV/AIDS, that could be SARS, which was an outbreak and a pandemic in way back 2003, and severe acute respiratory distress. And also that could be swine flu. A lot of pandemics and outbreaks were actually, for the first time, they have been reported as the case reports. So it means the case reports have been consistently proving its novelty and providing with exceptional knowledge to the medical research. Despite this, they have been given and allotted you know a place at the bottom of the evidence-based pyramid. That's very unfortunate. But what I feel and what I see this pyramid as is, you know for example, for any building or for any house or apartment to build strong and to stay strong, the base is very important, right? In the same way, for this pyramid, the base is very important. If the base is very strong enough, it is built in a very strong enough way, whatever we are going to put on the top would stay strong and stay long, right? So that's what I see this pyramid as, without case reports. And if you take off the base, everything else which are on the top might fall down or might skip the balance, right? So that's how I see this diagram. And so I just have collected some of the perceptions that I have been listening from people or from the professionals around me about case reports, and I've just tried to put them together. I heard a lot of times people saying that, case reports are anecdotes and rumors or gossips. Anecdotes is like, any conversation or any type of evidence. I mean, any type of information which doesn't have a base or which doesn't have any evidence. So those are known as anecdotes. Rumors and gossips you're very aware of. Also, as we have seen, most of the times, people consider case reports as one of the lowest evidence when they're making informed decisions. And they also think that case reports are not relevant for scientists or researchers, which is not true, because in any novel disease or novel outbreak like COVID-19 or any pandemic situations, case reports inform us a lot about its disease etiology, pathogenesis. And by keeping that in mind, actually the therapeutic strategies or therapeutic endpoints could be targeted, and it is really important from scientist standpoint of view. Oftentimes, it is also considered and termed as smoke without fire, meaning like, it might give, these case reports might give the false alarm. Maybe at times it might be a true situation, but most of the times it's not true. So these are some of the rumors or perceptions that I wanted to clear through this talk. But the actual reality is, although these case reports are considered as the lowest level of evidence in the pyramid hierarchy pyramid, this could actually act as a first line where the new issues and ideas can actually emerge, right? Without having any new disease or a new reaction, none of the case control studies or observational studies, randomized control trials or systematic and reviews and meta-analysis, there is no any strong rationale for research questions without any novel case reports or novel ideas which actually emerge from these case reports. That's the reason, I see these case reports as the base of the pyramid, which is really important. Base is really important, as we already know. And in suppose if multiple case reports are being reported, then those are known as case series. Case reports and case series are two different research designs or the entities. Don't get confused with this. And suppose if there are some case reports, and then if that has been turned into a case series, then actually they emerge and they form a research question for the researchers, and it poses actually a challenge for the researchers. Okay, come on, we here are the case reports, and here are the suspections, and here are the probable signals that have been identified. Why can't you conduct a high quality study or high quality study design, like retrospective study designs or observational like cohort study designs or randomized control trials? So then it's the time for RCTs or case control study designs to come into act and take up the research questions to assess actually if there is any association between the drug and the outcome that has been identified. So This is very interesting commentary that has been put together by the pharmacoepidemiologists and pharmacologists from the Netherlands way back in 2010, I believe. So even my perception or my idea of looking at case reports are pretty much similar like you guys before reading this paper. And this commentary actually, opened my eyes and shed some light on how exactly these case reports are useful and how they hold their own importance. And I strongly suggest you guys to go through this short essay paper. So briefly looking at its first box or the first table of this essay, where the authors have mentioned the hierarchy, which we have recently, seen in a couple of slides ago, that is evidence-based pyramid, where the top place is backed by systematic reviews and randomized control trials, then, prospective studies, retrospective studies, case controlled study designs, and then at the bottom, case reports and case series. This we already know, right? That's what I have been talking, like, case reports and case series are given the least priority. But the interesting part of this paper is the second table of this paper. Actually, if you look at the priority or the importance of these study designs, actually flipped. Then the first position was backed by these case reports, and at the bottom there are randomized controlled trials. Meaning, it all depends upon the situation. Also, it also depends upon the type of research question that a person or a researcher wanted to study. So personally, I feel we cannot say that, this is the hierarchy and systematic reviews or randomized controlled trials are on the top, which could actually inform the decision making, and always these case reports and case series are at the bottom. We have no right to say that, and it is not appropriate. That's what I thought of advocating these case reports from now on. It all depends upon the situation. Suppose if you we can actually, most of the times we can actually go with the box one, that is with the typical hierarchy, if the research question wants to assess the intervention or the effect of the treatment, or effect of the intended therapy. Whereas if someone wants to discover any medication or discover any treatment regimen, then the second box, or the the second priority would be a best option. So in that case, case reports will would be a lot of use. So that's all I have here. And moving on, let's very quickly see what's the importance that these case reports have in advancing the scientific knowledge. As I told, these case reports represent relevant, timely, and important evidence. And also it adds on to the medical scientific knowledge and the literature, especially of rare diseases. Suppose, for example, we all know that randomized control trials and RCTs are, they are considered as a gold standard when we wanted to assess or look at any association of the relationships in terms of efficacy. But I can best bet you that if someone wants to study rare diseases or the rare outcomes, I in the previous session, one of the participants or the delegates have put a question like, is a cohort study appropriate to assess the rare diseases? And my answer would be, in randomized controlled trials, it's a very rare. We actually cannot identify these rare diseases, whereas in such scenarios, case reports might play a major role. Although there are clear limitations with this methodological part of these case reports, but still, it's actually, end of the day, it's an observation of a single patient, which lacks the power and the methodological quality. A lot of questions on them, but still, it will walk you through the etiology, pathogenesis, natural history, how the disease has happened, or how the outcome or the reaction has taken place, and what could be the potential treatment targets for this particular, to handle this particular reaction in the future. Meaning, if you take observational studies, as Dr. Bhattacharya is mentioning, we have some guidelines to report them. Suppose for observational studies, we have STROBE guidelines, STROP, STROBE guidelines. We for the systematic reviews, we have PRISMA guidelines, and we have a lot of guidelines, when it comes to each type of study design. But for the case reports as such, we don't have any standard guidelines to report it. But still, these days, there are ICMR and certain organizations are coming up with framing some methodological and reporting guidelines for case reports. But still, what I want to say is it can actually inform us in the pathogenesis and the etiology of the disease and come up with a new therapeutic strategies, even though it has a weak methodological study designs. So let's look at an example, and I'm pretty sure that almost all of you know what is thalidomide and what exactly happened with it. Decades ago in 1960s. So thalidomide is a drug which is given for pregnant women for morning sickness. So and it has actually sorry, it has actually associated with congenital abnormalities, which is also known as phocomelia, which means we have seen a lot of babies taking birth with without limbs. So what exactly happened was, with this disaster being declared in 1962, I believe, there is a case report that was published in Lancet, I believe. So yeah, it's in Lancet in 1961, where a physician has reported a case for the first time before this being declared as a tragedy or a disaster, saying that, okay, dear editor, I know these abnormalities or these congenital abnormalities are prevalent in newborns around 1.5 percentage, but in my recent practice I have come across these congenital abnormalities in a drastic way, where I have seen around 20 percentage of congenital abnormalities in my practice. So is there something I'm the only one who is experiencing, or is there any other researchers or physicians around the world who was actually noticing the similar results? Then, after 1 year of publishing this case report, this thalidomide has been declared as a tragedy and as a disaster, and FDA has called up, and the drug has been withdrawn from the market for this morning sleeping sickness for among the pregnant women. So what I wanted to say is that's the actual importance of these case reports, which cannot be captured using randomized control trials or systematic reviews and meta-analysis, which are considered as gold standards of evidence. So let's very quickly look at the significance of these case reports in medical research. As I told, what about the essential information or the rare outcomes that have been missing or missed or undetected in these randomized control trials or clinical trials are actually could be informed by these case reports? That's the actual importance of these case reports in scientific observations. Also, as a thumb rule, as I mentioned earlier, but I wanted to go back to the concept again. If someone is conducting any observational study, suppose for example any experimental study like randomized control trial, and if they wanted to look at any rare outcomes, if they wanted to identify the rare events which actually could be identified in one among 1,000 patients. If someone follow 1,000 patients, the rare outcome could just be identified among one patient. So that's the rarity of that particular event. And if that is the case, as a thumb rule, any randomized control trial or observational study should follow 3,000 subjects in order to come up, in order to identify one rare event, which is like, unpractical, and it is like unrealistic. It's not going to be possible in the real world scenarios. Suppose if you take COVID-19 clinical trials or the RCTs that has been going on at a rapid pace, what's the sample size, what's the ratio or what's the proportion of the patients that are being involved or recruited in these randomized control trials. Also, regardless of the current pandemic, if you see most of the observational studies that are being conducted, the sample size could be around 2,000, 3,000. If it is a database study with electronic health records, that could be like 5,000 to 10,000. But having 3,000 individuals to be followed up in every study, it is like probably not practical for every study. So in such situations or the circumstances, there comes the importance or the significance of these case reports in medical research. So let's very quickly look at the what impact of the credibility that these case reports hold on pharmaceutical market, like in just kicking out the drug by proving its adverse reactions or the events. So I don't know, like it was a case report actually that linked to US FDA approved anorexic agents. Those are fenfluramine and dexfluramine. So basically, anorexic agents are the medications that have been prescribed for managing the weight. actually they just suppress they just provide this satiety of getting hunger. So in that way they just reduce the hunger, and eventually they reduce the weight of the individual. So these anorexic agents, namely fenfluramine and dexfenophuramine, have been kicked out of the withdrawn from the US market just solely based upon the evidence generated by these case reports, that is being proved to have a link of causing pulmonary hypertension. After this case report has been reported, there has been a lot of randomized control trials and observational studies that actually looked at this research question. This triggered a lot of trials to look at the incidence, what's the incidence of this association, and what actual mechanisms are involved in the for these anorexic agents to cause pulmonary hypertension. And eventually, these drugs are withdrawn from the market. So that's the impact and the credibility that these case reports hold on pharmaceutical market. Also, one best example could be thalidomide. As I told, we have seen the teratogenic effect of this thalidomide, that is phocomelia, and thus this drug has been withdrawn from the market because based upon the evidence generated from the case reports. And let's very quickly look at the some of the real world literature, what it exactly says in terms of the importance of these case reports. This is a pharmacoepidemiology and drug safety journal, which is highly and widely well-known popular journal among pharmacoepidemiology people. I'm sure nobody would have been heard about this journal. So there's a study that was conducted back in 2010, I believe. It was conducted in France, which actually looked at how many drugs have been withdrawn from France in between 1998 to 2004. And surprisingly, overall, there are 21 drugs that have been withdrawn from the France market. Out of these 21 drugs, the majority of these drugs, like 19 drugs, have been withdrawn just solely based upon the evidence that was generated from the individual safety case reports. So that's the importance I just wanted to highlight here, and that's what these study conclusions are stating, the importance of these case reports. So there's one more study which actually looked at the withdrawal of these drugs that was published in one of these Springer journals by name European Journal of Clinical Pharmacology. And in total, there are 22 drugs that have been withdrawn from the market due to safety reasons, out of which 18 drugs, around more than 80% of these drugs are kicked out of the market just based upon the individual case reports. So I just wanted to highlight that, just wanted to give you an essence like what's the importance of these case reports. And this picture here represents the knowledge time curve. On the y-axis, we have the knowledge, proportion of the knowledge, and on the x-axis, we have time, meaning when the drug is being actually approved by FDA or any approval authority bodies, the amount of knowledge that exists at that particular point of time is around 15% to maximum of 20%, meaning we still have a lot more to know about that particular drug, which will be actually assessed in the post marketing surveillance or in phase 4 or phase 5 studies. So it's really important to have an eye on case reports which are conducted, which comes under these post marketing surveillance, to know exactly the safety concerns or long-term safety issues of that particular drug, meaning that we might not actually know these long-term safety things in preclinical trials or phase 1, phase 2, and phase 3 trials. So I quickly want to differentiate the differences between RCTs and real world scenarios. I know in the previous session, Sandeepan has very well demonstrated the difference between clinical trials and clinical practice. But I just want to quickly, re-emphasize on this. I just came up with the 6 differences which I wanted to highlight here. The first one would be type of the individuals. As you already know, the picture itself represents in clinical trials, all the individuals will have similar features and similar characteristics because of the strict inclusion criteria. Whereas that's not the situation in the clinical practice. We have wide variety of patients, including special population like pregnant women, elderly people, older adults, and a lot of people like, children and all. Whereas most of the times in clinical trials, they do not recruit these special population. Coming to the sample size, it's very hard for a clinical trial to recruit a lot of people because of various reasons. Mostly, 2,000 to 3,000 people they'll be recruiting, and they'll be finishing up and winding up the clinical trial. But it is in real world scenario, we have billions and billions of patients to actually treat. Also, the duration of the study, which could differentiate the clinical trial and clinical practice. Usually, the clinical trials are done in a span of 3 to 5 years at the maximum. If you look at the COVID-19 trials that has been conducted at a rapid pace, within less than a year, some of the potential candidates for vaccine have entered the third phase, and some of them have already got the approval, and they are going to enter in the phase 4. But that's actually the scenario with clinical trials. But in clinical practice, a patient has to be on medications for long term, and long term side effects and long term scenarios could not be captured using clinical trials. Also, coexisting conditions, because of the highly restricted inclusion criteria, these clinical trials will have the patients or the individuals with similar characteristics. They might not have patients which could be of a representative of a sample of real world, who will have a lot of side comorbid conditions and other coexisting conditions. But in clinical practice, a patient could suppose a drug is being studied for hypertension, and a patient has been recruited in the clinical trial, where he might not have cancer or he might not have any diabetes. But in real world scenarios, a hypertensive patient might also have a cancer and also have a hypertension, where the results could vary actually. And the next one would be way of observing. Actually, in clinical trial, these investigators will make sure that they closely monitor patients or the individuals that are recruited in that clinical trial, whether they are taking medication or not, whether what about the dose, and whether the drug is being administered on timely basis or not. But in clinical practice, we cannot assure that patient is taking the medications in an appropriate manner, or timely manner. So the way of observation could be completely different from how we see things from clinical trials to clinical practice. And the last one would be type of questions, as Dr. Bhattacharjee was mentioning in the previous session. Mostly the majority of the clinical trials or the randomized control trials, they only focus on efficacy. In sense, it's not the appropriate term to use effectiveness. There is a lot of difference between efficacy and effectiveness. Basically, effectiveness will be observing in the real world scenarios, and in the clinical trials will be investigators will be assessing the efficacy, and they might be overseeing the safety concerns, whereas in the clinical practice, the safety concerns would play a major role. So in clinical trials, most of the clinical trials are being conducted by the major pharmaceutical companies, industries, and all the rich people, where they actually put a lot of money, and they want their drug to come into the market with fascinating results. They wanted to just prove their drug is doing really better with 90% of efficacy, 99% of the efficacy, when compared to the existing treatment or the placebo. So they just focus more on this efficacy, and they just ignore the safety concerns, which is really important in the clinical practice. So this figure actually represents the amount, the way, or the how these clinical trials and the clinical practice would recruit the patients. The black bars indicate the clinical trials, and the gray bars indicates the real world practice. On the x-axis, there are the patients with their age groups, and if you see the clinical trials, they don't have any patients under than age less than 35 years, meaning that they are completely excluding the children, infants, and younger older adults. And also, if you observe, even these clinical trials do not have or do not recruit any individuals with age over than 70 years, which is like they are completely eliminating the older people from their RCTs, or from their study designs, which is not the situation in the clinical practice. So this is an evidential example, like how RCTs could recruit patients or individuals in their study. So very quickly, let's look at the usefulness of these case reports in times of outbreaks, like pandemic situations like COVID-19. As I told, these are the new information, or it provides a novel information on emerging diseases or the infections like COVID-19, where there is no such reports that were reported previously or recorded previously. So it's very important to have an look at case reports. Even if you observe COVID-19, these were reported as a case reports and case studies early December in China, in the city of Wuhan, as a cluster of pneumonia cases. Then it became an outbreak, then endemic, and then epidemic, and then pandemic. And in small outbreaks, actually, these case reports play a very important role because they serve as a first documents to give some information to the decision makers and policy makers. They don't have any such information that is being recorded from RCTs and systematic reviews and meta-analysis. So they could act as the initial material or initial scientific documents. The best example or the classic example could be swine flu, which actually shook the world, one of the pandemics we all know that happened in 2009, where the first case report was reported from Mexico, actually from the North America. And then, I just wanted to highlight one important feature here. When the first case report has been reported in 2009 by Greselle, immediately the health authority bodies in Italy has alerted, and they have taken necessary precautionary steps in actually preparing for facing the pandemic, and actually to make their infrastructure and to actually the readiness of their infrastructure. And what I want to convey here is these case reports could also prepare or make the particular health bodies to actually be ready to face the pandemic of any such kind. The other example could be bird flu, which is also known as avian flu, that the most of our Asian countries like Philippines, India, uh, China has faced way back in 2010s. This could be one classic example of case reports where a lot of reports have been published on this bird flu, and later on a lot of observational studies have been conducted. So what's the role that these case reports hold on guiding policy and decision making, which is really important step and the last step for any drug to be approved? So it is not at all possible to perform a research on new emerging diseases or infections. Suppose if you take, for instance, COVID-19, it is impossible to conduct a high quality research at a larger scale. At the moment we observe a first case report or a first case in China or a first case in Canada or a first case in India, it is not at all realistic and not at all possible to conduct a large based study. First of all, they have to wait, researchers and health authorities have to wait and watch the dynamics of the disease, or how the disease is spreading, and what's the mechanisms and what's the pathogenesis, and what other drugs could actually stop or prevent this disease. They have to watch and wait for few months. That's what we have been doing with this pandemic, with just following a precautionary measures, wearing a mask and cleaning our hands, and we don't have any potential therapeutic regimens. But after 6 months, when we at least know how it happened, and how exactly the COVID-19 is changing day by day, its dynamics, then they start randomized control trials or any observational studies to look at by recruiting the patients. So what I want to say, it's highly impossible to conduct a high quality research on new emerging infections for the first appearance. And mostly all these government bodies and health authorities, the first target is to control the disease, not to develop a vaccine or not to develop any potential therapeutic medication for the outbreak or the pandemic. First, they wanted to control the disease by following some precautionary measures. And then once we know the information from these case reports and case series, then it actually enables us to look at the broader range and at a larger scale. So hence the data that has been generated from these case reports could be really useful in planning a policy and decision making. So one such example could be SARS preparedness program way back in 2003, where the first there is a SARS preparedness program that has been developed solely based upon the case reports in last decade, and it has actually helped a lot for a lot of countries to be prepared for SARS-CoV-2. With these preparedness programs, for example, Taiwan, they actually, they have established a lot of epidemiological surveillance bodies to foresee these pandemics and outbreaks from the lessons learned from this SARS outbreak in 2003. So that's how these case reports can actually guide in policy and decision making. So the safety monitoring, actually, as I told, the spontaneous reports are being reported to the national and local pharmacovigilance centers. But these days, these regulatory authorities, they don't want to put a lot of pressure on healthcare professionals to report these areas, and instead they are actually depending upon these case reports to actually monitor the signals, because the one possible way of doing this would be in case reports, they are actually peer reviewed by the editors and the peer reviewer scientific community, and that means they have the higher standards and higher quality rather than just reporting an adverse drug reaction to any regulatory authorities. So they wanted to bring down the burden on these healthcare professionals in reporting these safety reports, and they are actually focusing on these case reports which are publishing in the high quality journals. So I just sum up my talk with just listing some of the strengths and limitations of case reports. The first strength could be, as I told, it helps us to identify the new trends, new diseases, that could be new therapeutic options as well, with the help of case reports, and which is highly impossible to come across from randomized control trials and observational studies. Also, these case reports help in detecting new drug side effects. As I told, these are the first events that have been observed in a single patient, which are not being reported or which was not well known in the past. And it also could be a potential use, the repurposing of the drug, which is a hot topic for COVID-19. Like, anti-malarial drugs like hydroxychloroquine has been considered as a potential treatment for COVID-19. So these case reports could actually also come up with the potential uses or off-label indications of any medications, not just the reactions or the diseases itself. Also, these could serve as an initial scientific material. As I told, when we don't have any information about a new disease or new outcome or any event, we have to go with these case reports in order to better understand about the dynamics of the particular current disease or the current event. Also, these are inexpensive and short duration of time. These are there is no need of a lot of money to put in to conduct these case reports. They can be instantly reported with a shorter duration of time, like less than a week or less than 2 weeks. So it's like really good. And there are some of the strengths. And moving on to the limitations, there is a lot of questionability in terms of generalizability, because as a fact, we know it's just a single novel report that we have observed from a single patient, meaning that if suppose the valporic acid and the hair curling thing which I have mentioned in my earlier slides, we might not expect that effect in other people or other patients who are on valporic acid, right? So the generalizability or the external validity of the case reports would be very, very minimal. That could be one major limitation. Other thing would be, we cannot say the causal association or the actual association between the exposure and the event, or the exposure and the outcome, using these case reports, meaning the causal inferences or the correlations cannot be certain using these case reports. In that in such stance, randomized controlled trials would be one best way to assess the causality and the association. The other one would be misleading information. Sometimes case reports can lead to false alarm. I mean, like smoke without fire. We have seen some situations where the drugs have been withdrawn from the market, where actually later they proved that it's not the drug that actually caused that reaction. There are a couple of examples which I can actually which I would like to share with you end of the presentation if someone is interested in the question answer session. Also, it lacks a denominator. We actually don't know how many people are facing these these side effects or these adverse drug reactions. So we actually lack the denominator. I mean, the total number of individuals that are experiencing these reactions. So it is very we cannot actually calculate any rate using these case reports. That would be one major limitation. Also, we lack comparison group or control group, and without any comparator, we cannot actually say the rate or the severity of that particular reaction, right? It could be observed in one individual or 10 patients or 20 patients, but without a comparison group, we cannot actually assess the severity, how severe this disease or this reaction could be. And as a fact that none of the case reports will involve any statistical analysis, thus they lack the statistical power to say the association or to come up with the causality. Also, it is always challenging to say whether actually the drug caused the reaction or not. If you take 100 case reports, majority of the case reports, like 80% of the case reports, will probably conclude that the chance, I mean, the relationship would be probable or maybe possible, but they are not 100% sure. Yes, it is certain that this drug could cause this, and in such scenarios, it is very challenging to assess the causal inferences. So in a nutshell, case reports are extremely valuable, although they are very underestimated in the current scenario. especially in terms of when you wanted to study new or rare diseases or outbreaks. And it could actually used as a useful tool in generating the research questions. If you have a case report only, then it gives you a good research question to be assessed in a case controlled study or a observational study or in any randomized controlled trial. So that's what I told, it forms a base and it is like an initial information. So the take-home messages could be, in short, case reports are interesting case. I mean, in a detailed, which are described in a detailed manner of any new condition or new therapeutic options that are being identified. This could actually enhance the therapeutic practices by sharing real world experiences, meaning, like, if you look at any case report, it's like interviewing a patient, like, sharing their opinion or feelings, like, how do they feel when they have that side effect or the adverse effect, and whether what are the real world experiences which might lack in randomized control trials or observational studies using big data. Also, case reports support the emergence of new research. As I told, it is the first step and the starting step to conduct the higher level of study designs. It could act as an initial step. Thus, it has high sensitivity to detect the novelty or to detect the rare outcomes or to detect any possible reactions or the outcomes related to the drugs. Thus, I strongly consider that these case reports are cornerstone for this drug safety research. So that's all I have, and I know I have been a bit fast and I have rushed a lot because I was just requested to restrict or permit my talk to 30 minutes, and I'm happy to take any questions if we have. So
So we are really grateful for taking time out and really speaking to us in detail about case reports. And I think one thing that you have made very clear is your stand for case reports. And indeed, without case reports, we have no randomized controlled trials. So they definitely form the foundation of all research, and there is no doubt about it. Correct me if I'm wrong, sir. I think even in the middle of this COVID-19 pandemic, when we had trials with many new vaccines that came out, there was a case which said that a life was lost, and that led to the entire drug being withdrawn entirely. So these are, I think, these are not small things that a case report has done. These are steps that have happened on a large scale. So it does really mean a lot. And we have two questions for you, sir. Um, One is by Aifa. She has asked on how we could spread awareness. Now, you said that we have a few misconceptions among health professionals, which, kind of demeanor or look down on the value of case reports. So, how can we do, or what are the practical steps that we can really apply to spread awareness concerning case reports?
Thank you. It's actually a good question. So, firstly, I wanted to, give a disclaimer that I'm just advocating case reports, which means that I'm not, deceiving the other study designs like randomized control trials and systematic reviews and meta-analysis. In fact, I'm one of such researchers who always conduct systematic reviews and RCTs here. And coming to this question, coming to the awareness and educating people, there are multiple ways. The one best way could be like what I'm doing right now. Whenever I get a chance to speak at various conferences or any other platforms, you can just take up a challenge in letting people know what's the importance of the case reports. And I do agree with the fact, the same student or a person could ask me a next question that is like, no one, majority of we might not get an opportunity to speak at the conferences and to pick up such questions, to deliver a talk in such scenario. Suppose this is a conference where I believe you have a scientific sessions where you have given a chance to present a poster or e-poster or a oral presentation. You can take this as a challenge, and you can just present a case report or any research related to drug safety or pharmacovigilance in such way. People will understand. Even the committee members or the faculty members will see the number of abstracts they have being received related to this drug safety research in terms of case reports, and that's how the awareness could be increased. And the other one could be like, you can actually publish the case reports in reputed journals. In that way, you can also disseminate the knowledge and bring back the awareness of case reports, the importance of case reports among public or healthcare professionals. I hope I have answered your question.
Yes, sir, you have. So we have a second question as well by Mr. Safal. He has asked if we can arrive at a conclusion about an ADR by relying on a case report.
Yeah, that's what we do, right? We have a lot of scales and the checklist. We actually look at the causality like Lorenzo scale, WHO scale, and we go through. We very stringently go through the all the questions, like whole bunch of questions, like 7 to 10 questions, and then we assign the causality, whether it is unlikely, which lasts to certain. Definitely, we can come to the conclusion with regard to that specific case report. The case which you have identified in under the guidance of any physician or a faculty member in the pharmacy itself. So we can actually make conclusions for that case, but it could not be generalized. That's what I meant. One of the limitations in my limitations section. It doesn't mean you identified a case report. I mean, this drug can cause this reaction. It doesn't mean that this drug can cause this reaction in other patients, or it's not a general thing in all other cases. In your case, yes, the conclusion might be correct.
Right. So we know that it's really late for you back in Canada, and despite that, you have stayed up to share your experience with us, and that really shows your commitment to work. So thank you so much for coming up on our conference, and we are really grateful. Thank you, sir.
It was always my pleasure, and thanks to the NITE organizers, especially Dr. Uday Venkat Mateti, for giving me this opportunity. And yep,
It was our privilege, sir. Thank you.
thank you, everyone.